Question number 86. Ulnar side rest pain, radiographs with positive ulnar variance. MRI2 central perforation of the triangular fibrocartilage complex with chondromalacic chain lunate, whose very contains ulnar impaction syndrome. Further hints there is ulnar variance and wrist pain. So ulnar variance and wrist pain shows ulnar impaction syndrome on MRI the central perforation of triangular fibrocartilage complex and positive ulnar variance to diagnose ulnar impaction syndrome. Question 87. With the following not recognized cause of bone appearance, renal osteodystrophy. It has punch out lesion, but not bone appearance. Bone appearance are seen in high density lesions, high density bone. So renal dystrophy is not a cause of bone appearance. Other causes of bone appearance are osteogenesis imperfecta, Better baby syndrome, and fluorosis, osteopetrosis. With 88, MRI shows which of the following periods favor diagnosis of cystitis rather than degenerative disease. Intermediate signal posterior to the vertebral body on T1 weighted imaging. Cystitis, so intermediate signal T1. Which feature favors diagnosis of cystitis rather than degenerative disease? Intermediate signal posterior to vertebral body on T1 weighted images. Cystitis, so intermediate signal on T1. Question 89. Which supporting buttress of the face is disrupted in 842 but is spared in 841 fracture superior medial maxillary? Report 1, report 2, report 1, report 2 fracture. Which buttress is disrupted in report 2 but spared in report 1? Superior medial and maxillary. Superior medial and maxillary buttress is disrupted in report 2 but spared in report 1. Question 190. Acne and discharging pustules in his palms. Radiograph of the shoulders with hyperostosis and early ankylosing of the sternoclavicular joint, most likely diagnosed SAPO syndrome. Now, SAPO stands for it is a thread of symptoms in SAPO, multiple symptoms. Acne and disrupting pustules on his palms. Radiograph of the shoulders with hyperostosis and early ankylosing of the sternoclavicular joint, most likely diagnosed SAPHO syndrome. 91. Which of the following is most likely to support diagnosis of fibrous dysplasia or Bright's disease? Ground glass medulla. In fibrous dysplasia, there is ground glass medulla disease. These seen fibrous dysplasia, ground glass medulla seen fibrous dysplasia. Ground glass medulla seen fibrous dysplasia. Now, question number 92. Vertebral bone marrow edema, low signal on T1, high signal on T2 images occurs in all but in which of the condition? Multiple myeloma. Vertebral bone marrow edema, low signal on T1 and high on T2 images occur in all but what condition? Multiple myeloma. Vertebral bone marrow edema and low signal on T1 and high signal on T2 images occur in all except which condition? Multiple myeloma. Question 93. Elderly man, TC labeled triphosphonate bone scintigraphy, axial thickness was diffuse, hypotenuse, stress uptake. Most typical of these appearances was metastasis. In elderly male, when there is TC99M increased uptake on axial skeleton, diffuse homogeneous stress uptake most likely causes appearances for metastasis. Elderly man with diffuse homogeneous stress uptake in axial skeleton on scintigraphy most likely causes posterior metastasis. Question 94. Radiograph shows distorted lesion in the identified chordoma. Radiograph of distorted lesion in the identified midline of inferior sacrum with internal areas of calcification. MRI shows a heterogeneous lesion replacing much of the sacrum, which returns moderate low on signal T1, high signal T2, with a soft tissue component extending in the precycle soft tissue spaces. Soft tissue component extending into precycle soft tissue. Parents was partially moderate enhancement with intravenous gadolinium. Most likely diagnosed chordoma. Correct? This is chordoma. Structural lesion in the sacrum and internal areas of calcification. Question 95. 70-year-old again this is chordoma. The structural lesion in the sacrum with internal soft tissue calcification. Question number 95. 70-year-old man attends a 6-week follow-up appointment after cemented to her hip arthroplasty, complaining of poor range of motion. Radiograph taken to an apartment shows small areas of pericapsular bone and formation of small bone spurs. Small areas of pericapsular bone and bone spurs At the acetabular margin, CT scan shows these areas to have well-defined mineralization peripherally and in the disc center, which poses a responsible heterotrophic ossification. Post after total cemented hip arthroplasty, there are multiple bone spurs and irregular bone islands, polycapsular bone, diagnosed heterotrophic ossification. Question 96. 30-year-old woman in the third trimester of pregnancy complains of a 4-week girl history of girl onset pain in the left hip following minor trauma. The graph shows normal appearing joint space, mild osteopenia of the femoral head and neck, and indistinct subgular femoral head. On subsequent MRI, the bone marrow in the affected region returned patchy but diffuse low signal on T1 and high signal on T2 with images. There's similar small area of marrow abnormality in the acetabulum and a small hip effusion is seen with most likely diagnosis, transient osteoporosis. First, pregnant lady with gradual onset of pain in the left hip following minor trauma, diagnosed transient osteoporosis. Pregnant lady with gradual onset of pain in the left hip following minor trauma, diagnosed transient osteoporosis. Question 97. Which of the following can cause a false negative result in a profound ultrasound scan of the shoulder from suspected rotator cuff tear, limit joint mobility? In suspected rotator cuff tear, limit joint mobility can cause a false negative result. In suspected rotator cuff tear, limit joint mobility can cause a false negative result. Question number 98. Following wrist arthrography by a single compound radiocarbon injection technique, contrast seen on MR arthrographic images in the mid-carbon component can be explained by disruption of the following structure, tricuspid ligament, mid-carbon contrast. Following wrist arthrography by a single compound radiocarbon injection technique, contrast seen on MR arthrographic images in the mid-carbon component, contrast in the mid-carbon component can be explained by disruption of tricuspid ligament, mid-carbon contrast. Question 99. A young footballer has twisting injury to the right knee. MRI shows effusion and truncated medial meniscus with a bow tie configuration, coupled appearance of the posterior cochlear ligament, most likely injury to medial meniscus. Now again, with absent bow tie sign, reference to the loss of normal appearance of the menisci on paracycle MRI images and suggestion of negligent injury. This is normal bow tie sign. Can you see the dark area? Loss of bow tie sign. Loss of bow tie sign suggests meniscal injury. This is bucket handle tear of double PCL sign due to bucket handle tear of PCL. Now, there see truncated medial meniscus with a bow tie configuration, double appearance of posterior cochlear ligament, double appearance of posterior cochlear ligament. Diagnosis: torn medial meniscus. Question 100. Pain. The next one, question number. Pain radiograph of the femur performed. Pain radiograph of the femur performed for pain revealed a centrally located loosened lesion in the medulla with a partly calcified matrix, which of the following features favor diagnosis of chondrosarcoma and chondroma, deep endosteal scalloping. Which features favor diagnosis of chondrosarcoma, endosarcoma, and chondroma, deep endosteal scalloping. Which features favor the diagnosis of chondrosarcoma and chondroma, deep endosteal scalloping. So,